large welcome to all of you here tonight. We're having a Marathon County community conversation about childcare. And I want to take an opportunity to say thank you to all of you who came out tonight or are online with us tonight. We all have busy lives and schedules, and it's important, though, to have a conversation about our most vulnerable citizens, our young children, and specifically where they spend their time when their parents are working or otherwise engaged. And so, hence our childcare conversation tonight. I want to take some time to publicly acknowledge and thank anyone, and I know there are some of you out there who are attending tonight who are childcare providers, who are childcare teachers or directors, and wanting to let you know that we believe that what you do makes a significant difference in the lives of young children, and we respect and need you and are so thankful that you are here joining us tonight. To everyone, yeah, we could do a round of applause, Laura. I completely agree with you. To everybody attending, we appreciate you, your thoughts, and feedback as we move through the program this evening. My name is Kelly Borchard, and I'm the Executive Director of Childcaring, and I'd like to take a few minutes to acknowledge the people who have worked together to organize this event tonight and be here with us this evening. And so I want to acknowledge Elsa Duranzo. So she's from the North Central Wisconsin Workforce Development Board. She's responsible for organizing us and speaking here tonight, but especially pulling us all together and getting us here to talk about this important topic. We have also partnering with Marathon County and the city of Wausau, and we're really fortunate to have Laura Scuderi with us here tonight from the Health Department in Marathon County, and she will be speaking here tonight as well. We are also expecting a representative, Kelly Matthews, from the Wisconsin Early Childhood Association. She's going to be speaking tonight as well. And we just want to say thank you to UW Stevens Point Wausau campus for this really great space that they were able to share with us tonight, and the technology piece is super awesome for us. So thank you everybody for being here. So the first piece on our agenda is for us to talk a little bit more about the child care landscape here in Marathon County. So again, I'm Kelly Borchard. I'm the Executive Director of Childcaring, which is the local child care resource and referral agency serving Marathon County and 9 additional counties in central Wisconsin. And this particular slide references our mission and our vision as a nonprofit agency serving central Wisconsin. So you can see that our mission is for all central Wisconsin children to benefit from the best possible child care. So we support families in their search for child care, we support the area child care programs, and we help communities understand the importance of quality child care. And again, that's why we're here this evening. So I'm here to share with you some information and data that's very specific to this county here in Marathon County. Child care resource and referral agencies like Childcaring began in the 1970s as a result of an increase in dual working families and the need for child care. And so we're one of many different organizations that support and offer services to child care programs in the state of Wisconsin. You will also hear from the Wisconsin Early Childhood Association, which is another support for child care programs. And interestingly, in Wisconsin, we have one of the highest numbers of dual working families and children in child care. So in the state of Wisconsin, about 75% of children are in some type of out-of-home care situation. This slide represents a few of the services that Childcaring provides. I'll just briefly touch on a few of them. So we help families in their search for regulated child care, offer them information about choosing a quality program. We're currently administering the quality rating system called YoungStar. We offer assistance and training to area child care providers. We also offer some grants for families to help pay for care, as well as grants for programs who want to get started in this field. And then on the data and planning end of things, we are often working with people who want to start a child care program, talking about needs assessments and capacity, average wages of child care workers and rates. And we also offer some parent cafes to families in specific counties. And so you can see we're funded as well, mainly through the state of Wisconsin Department of Children and Families. We have some private contracts we're funded by United Way here in Marathon County, especially for those Good Start grants. Here are some of the data points about the current landscape of childcare. So today, we have 85 regulated childcare programs with the capacity to serve 3,214 children. You will note that the average wages of people who work in childcare are often misunderstood, and childcare directors on average make about $17 an hour. Teachers who work in childcare programs in Marathon County make just over $12.50 an hour. Childcaring, again, like I mentioned to you, helps families find childcare, and in 2021 and 22, we've helped over 500 families in their search for childcare, and then we've granted 54 families funding to help pay for childcare. Here's where we're going to really get into the nuts and bolts of childcare and some of the issues that we face in this field. And so the first thing we want to talk about, anybody in the audience or online who's had to pay for childcare knows that it is extremely expensive. Sometimes the cost of childcare is one of the highest in a family's monthly budget. It's often more than housing, college tuition, transportation, or food. And families all across the country know about the difficulties in finding quality childcare that's affordable. So this issue isn't necessarily unique to Marathon County. What we're talking about specifically here, oh, I'm sorry, you know what? I forgot to switch a slide. Or maybe I'm having trouble. There it is. This is what I wanted to show you. Average rates. So a child under the age of 2, you can expect to pay anywhere from $168 a week to $237 a week for a child under the age of 2. You can see that 2 to 4-year-olds, you might pay anywhere from $158 to $199 a week. And then as a child becomes older, you often pay a little bit less. Infant care is the most expensive to offer. A family with a child under the age of 1 receiving care in a group child care setting will actually pay 3 times the amount, an affordable amount, because the federal government defines affordable care as no more than 7% of a family's yearly income. So you can see that childcare is quite expensive here. And in fact, many families have 2 children in care, and you're gonna probably pay more than $20,000 a year for childcare. And putting that in context, for example, of college tuition in Wisconsin, which is running about $12,000 a year. So that's a little bit about that. And so I think another topic that we've been discussing a lot here in Marathon County is the availability of regulated childcare. So what we've noticed in the past decade is we've lost about 57% of our childcare programs in the last decade. In 2012, we had 199 regulated programs. Today, we have 85. It's a significant decrease in programs. And then when we look at the child care slots, so each child care program is licensed to provide care for a certain number of children. We've lost over 1,000 child care slots in the past decade here in Marathon County. Very significant, and in fact, 50% of the zip codes in Wisconsin are considered a child care desert, where there's areas with little to no access for quality child care. Digging a little bit deeper into the child care capacity, we know that in Marathon County there's 85 programs. That consists of child care centers, family child care programs, preschool programs, and school-age programs. And this is a breakdown of the capacities of each one of those regulated child care programs. Those programs participating in Young Star, the quality rating system, about 52% of them are rated 3, 4, or 5 stars here in Marathon County. And what we know is that we need hundreds of child care staff here in Marathon County to keep these 85 child care programs in operation. Quite frankly, the child care workforce situation is at a crisis level. Those of you in child care, I'm certain, are nodding your heads right now in agreement. Very difficult times with child care workforce today. To look a little bit more specifically at that, we know that finding workers and finding employees is difficult for many businesses. In childcare specifically, some of the workforce shortages are attributed to a general lack of applicants. We hear from directors that sometimes there's not one person that applies for an open position. There's low wages and benefits, as we discussed a bit ago. We feel like there's a lack of value and respect for the early childhood profession. There's a lot of burnout, and there's a lot of staff that turn over and quit. We know that parents are finding it difficult to find childcare because there's a lack of childcare staff. The wait lists can be 30 infants long. You can be waiting longer than a year to find a childcare spot. A lot of this is due to building and classroom closures due to COVID. So while their childcare situation was difficult, it's even more difficult now after working through COVID because there's still classrooms and buildings that continue to be closed because of that. The other thing that we know is that we need long-term support for childcare. We know that there's temporary funding available right now through the Department of Children and Families. There's a lot of opportunity right now, but what happens when those COVID relief dollars are gone is where we're very, very concerned. We have a quote here from Krista Guyland, who is the part of the Wisconsin Child Care Administrators Association Board, and she says, "This is a concern for nearly every child care director across the state. How will centers continue to operate when that ceases in February of 2024? We may struggle to find adequate resources and grants to keep us up and running." This is a slide that really talks about why everybody needs to care about early childhood education, right? Studies indicate that children who benefit from quality early care and education experiences have many benefits. There's greater learning readiness, there's improved cognitive ability and social skills, there's lower rates of grade retention, higher labor force participation, lower use of welfare and other subsidies, they earn higher wages. There's just a tremendous amount of data and research that tells us that everybody needs to be concerned about what happens to kids before they even enter the public school system. So one of the ways we talked about, there are some things that the state is doing currently to help support childcare with some of the COVID relief dollars. One of the ways in which the state is currently supporting some of the initiatives besides the Child Care Counts funding is they've dedicated some COVID relief funds to a project called Project Growth. And in Marathon County, we happen to be benefiting from both of these programs. And so we have a Partner Up program that we're helping to administer, and currently there are 3 businesses here in Marathon County that have 15 of their child care slots. They have 15 of their employees benefiting from this program, and they're being funded for their child care. It's a partner program where businesses contribute some of the funding as well as the state, so that child care for particular businesses, their employees, is covered. Great program, again, limited term. Then we also are super fortunate, and that's part of the reason why we're here with you tonight, is because Marathon County was also a recipient of a Dream Up grant. And so communities in Wisconsin were offered an opportunity to apply for this funding, which allowed you to do some strategic planning efforts. And so we've been meeting many organizations, you can see are listed here under our core team, and we've been meeting to talk about childcare in a very strategic manner. And part of this event tonight is building off of some of our conversations. So we're super fortunate again to have that opportunity. And this is the end of the piece that I'm here to talk about tonight. Again, I'm Kelly Borchard, and there's my contact information. I want to acknowledge here in the room with us tonight, too, is our business child care advocate. Her name is Sarah Agonot, and she's the person on our staff who is working with the Partner Up program and the businesses and the child care programs to help coordinate that. I am now going to turn it over to Laura Scuderi, who's going to come and talk a little bit more about some of the work that we've been doing with our Dream Up grant. So thank you, Laura.
All right. Thanks, Kelly. Okay. Hello, my name is Laura Scuderi. I'm Marathon County's health officer, and I just have a quick 430 slides to go through with you today. I'm just kidding. I'm kidding. Some of you got real nervous when I said that, but we've all been there. Okay, so my job really at the health department is to work with our community to prevent disease, promote health, and protect the public from environmental health hazards. And as everyone here is aware, lack of access to health or childcare is not just a parent issue or an employer issue, but a growing public health concern and a community-wide need. Research on early childhood education and childcare have long-standing impacts on the overall health of a community. And in response to this need, Marathon County, with a number of key community partners, applied for the Dream Up grant. So what is Dream Up? I want to give you an overview of the grant, which provides support to create a strategic vision for our community regarding childcare. The Dream Up grant was applied for in April 2022 by Marathon County, and we received it in August. This grant was supplied by Children's First Finance and is awarded to communities who are trying to develop a strategic plans regarding increasing quality childcare availability. This is an identified need. And access to affordable childcare is scarce in our area, as Kelly just discussed, causing families to struggle. And currently in our county, 50% of our zip codes are attributed to being childcare deserts. In addition, approximately 35% of Marathon County hospitals struggle to meet basic costs of living, according to the Alice report, and the majority of those living in poverty are women aged 25 to 34. I'd be remiss if I did not mention that this grant is just one piece of the strategic discussion about childcare availability in our area. As Kelly mentioned, there are other things going on, other grants have been received, and many of my colleagues have been working on this problem for many years. So childcare accessibility is a structural problem, or as we say in public health, a complex, tangle, or a wicked problem, and it's not one agency or organization can solve this alone. So thankfully, we have a lot of organizations looking at this and how to partner together. So these are our current stakeholders. You can see I don't know if you can see the text is very small, but these are the current stakeholders that have been contributing through strategic discussions. And you can see that this is a very big group of active members all coming together to solve this community-wide issue. Many of these individuals have been chipping away at this issue through other projects and groups. And in a moment, we'll hear from Elsa and on the WIA grant, for example, but there's much more happening on this issue than just the Dream Up grant alone. So what is Dream Up specifically doing? This is our grant result. So the stakeholders on the last slide have been working to understand the breadth of the problem we were trying to solve, as well as develop a vision for our efforts. We are using the results-based accountability model, which is a tool that helps groups find a common language and identify a result, a data indicator, and then use evidence-based practice to get the outcomes that positively impact our community. Now, that's a lot of public health talk, I know. But what that basically means is that we're looking for programs that work and that will work for our community. On this slide is the grant result, which the community stakeholders all decided on, is that all working families in Marathon County have accessible, affordable, quality child care in their community. What you see here may seem simple, but this was the outcome of a lot of discussion to identify what problem we were actually going to tackle regarding childcare. We had some great discussion on whether we were trying to work on improving conditions for employers, for children, for families, parents. Who are we trying to improve the situation for? Of course, there are no right answers. All of them are the right answers. We need to figure out what our group could specifically influence. So we had to find a common language to work with. So working families, what we mean by working families is a parent or guardian can remain in the workforce. And we're specifically speaking about regulated child care providers in this result here. The group met yesterday. And their job was to tackle the question, if we were successful, what would be different? When I describe public health efforts that succeed and fail, I like to talk about there being no silver bullet. We need to take a systems approach to change. If the problem was easy to solve, one of us would have done it by now. But one person said that when it comes to solving community issues, we need to stop believing in silver bullet options. We need to think more about silver buckshot. Lots of little changes and coordinated strategy will make a difference. So here are our indicators that the group decided on yesterday. Number of regulated childcare providers in Marathon County and the total number of childcare slots of regulated childcare providers in Marathon County. Oh. Okay, there we go. Here's the graph of the first indicator, and this can be viewed on Marathon County Pulse. And so if you just go into Google and search Marathon County Pulse, you'll get all kinds of really great data. It's the number of regulated child care providers in Marathon County and this data is actually from Childcaring. See this curve, how it curves down? We call the next process in our development of the strategy, we call the next process turning the curve. And so our strategies and performance measures will all work in service to pushing this curve back upwards. And you can see, like, this is a projection. If we're successful, this is what the change that we're going to want to see. We're going to want to see this curve go back up. Let's see. Come on. There we go. So here's the other indicator that lives on Marathon County Pulse, and this one is also data from Childcaring. Thank you, Kelly. And it is the total capacity of child care providers in Marathon County, and you can see that we need to increase capacity here. And here is another little projection on, what it would look like. What would be a measure of success? How would we know? And we would want to turn that curve back up. So what we're going to do to turn that curve is we're going to talk about a couple things. We're going to talk about the factors that decrease the number of regulated child care providers and what factors increase that. And in doing so, the factors will translate into strategies. And that is the subject for our next meeting. It's pretty exciting. And we're going to do it with the other indicator too. So we'll be, again, talking about what factors decrease the total capacity of child care providers and what factors will increase and decrease. All right, and so the final steps for the grant, as you can see, we have work yet to accomplish. So we're going to be working as a facilitator. Marathon County has committed to facilitating the process going forward. We'll continue to work towards our shared goal of making sure that all working families in Marathon County have accessible, affordable, quality child care in our community. And we'll continue this process. We're going to determine our strategies next. So thank you for your time today. See, it wasn't 400 slides. All right, and I will turn it back over to Kelly. Okay. All right, thank you.
I'm actually turning it over to another Kelly. Kelly Matthews is here from the Wisconsin Early Childhood Association, and Kelly will invite you to come on up, and I'll show you that this cool little clicker will click your slides for you. All right,
Thank you,
welcome.
Kelly. I apologize for being a little bit late, getting out of full meetings, talking about childcare in multiple communities around the state is pretty much my full-time job right now. So I am delighted to be here, and my view of what I'm bringing to the conversation tonight is a little bit of a overview of some state trends. Kelly really honed in specifically on Marathon, but you will see these trends sort of replicated across the state, actually. So I work with the Wisconsin Early Childhood Association. We are a statewide entity serving child care providers in all 72 counties. We have a number of programs that we run that we can provide assistance. We have Teach scholarships that can help early educators get basically college credit for working with young children and being able to get their degrees at the same time. So we can do that at little to no cost with them with additional supports to that scholarship. They have a counselor. They get their books paid for, they get release time, they get a travel stipend, even if things are all remote, to basically help be a surrounding support as they move through that scholarship. We also have the reward program, which is a wage stipend. We know right now, you saw some of the stats, the wages in early childhood have been and continue to be lower and compressed due to market constraint. And so the reward stipend basically says thank you for staying in the field and meeting certain educational requirements. Recently, we have had an infusion of grant dollars towards the reward stipend and the Teach scholarship, and they have been able to lower some of the eligibilities for the reward stipend and increase the amounts. So anybody in the childcare world in a regulated program If you know them, if you love them, if you care about them, make sure they know about reward so that those dollars can get into their pockets. We are also a statewide food program sponsor, which means we can reimburse family child care providers for serving healthy and nutritious meals. CCR&Rs are often a regional food sponsor as well for family child care. We have Raising Wisconsin, which I'm going to talk a little bit about today. That's our newest endeavor. WECA has been doing advocacy for a long time, but this is a 50 partner plus cross-sector advocacy beast that is coming with some audacious plans for Wisconsin and its children. And then WECEN, which is going to be the longest name ever, the Wisconsin Early Education Shared Services Network. That's the program that I direct. It is currently serving over 1,600 programs across the state. It is available to regulated programs in every county, including Marathon, and I'm going to talk just a little bit about what we're able to offer there. We have 3 tiers of service. The first and second tier are available statewide. As you look at this list, it is a mix of technology supports, professional development training, human support, and helping folks navigate systems. So we have recently been able to add a waitlist concierge. So as Kelly was sharing, some waitlists are 30+ babies long. Providers often, and family providers, spend a lot of time trying to navigate and negotiate and managing. I see you nodding your head. Some people have big whiteboards or Post-its. Some folks do spreadsheets. This program actually helps when a provider can identify this is the priority for that slot. It can move through the waitlist and identify which families actually fit the demographics that the spot opening is for. Providers have reported it being very helpful in cutting down amount of time of getting a new family in and basically saving time, not having to go through all of those Post-its or all of the files to find out who might be the next best fit for that opening that they might actually have. All of our services are available in English and Spanish. That's very important to us as part of our equity work. The Wiser platform, which is a digital platform that has over 2,600 resources for folks. So WECEN exists basically to help providers save time and money. We are a free program. We had to put that on the slide because as people look over this list of benefits, they're like, is this really all free? Yes, it really is all free. We are generously funded by the Department of Children and Families right now and are able to provide personalized support for programs. At the Tier 2 level, we have dedicated coaches who meet with programs and they can say, hey, DCF just released this thing. I don't know what it means. Like, I thought they said something else, but now they're saying this. How do we know what's right? And our coaches can dig in with them and get them timely, accurate information to help them move through some of those other systems that sometimes can feel like they're barriers. We, at our Tier 3 level, have a really deep level of service around coaching. We have shared back office, so childcare programs can actually offload their billing and receiving and collection to our staff to basically free up that director's time or that family provider's time. We have a relief squad, which is a qualified substitute pool that are on our payroll. We do the background checks and all of that, and then they can be scheduled out for programs. We know with the staffing crisis right now, that is a very popular part of our services. WECEN continues to advocate and figure out new ways to support programs. We will be rolling out an EAP, an employer assistance program, not just to the child care leaders like the directors and the family providers, but every employee in every child care program that is in WECEN will be eligible to receive those services for their employees, which you take 1,600 child care programs times all the employees, and that is going to be a big impact. So we're excited about that. So part of WECA's job is to basically, what can we do to help, right? That's what CCRs do, that's what we do, and figuring out how to bring all of those resources to Marathon County to its best use is part of what our work is. I'm going to give you just a couple slides of the state of the state. This came from research that was released earlier this spring. This basically shows where children are spending their time. So that big orange block in that first column shows that a lot of the younger kids are spending their time in family childcare. That is typically a choice that a family can make. Centers are great, families also choose that, but statistics show that family childcare tends to be a higher used placement for younger kids. It makes sense for a lot of reasons: smaller groups, more home-like environment, right? As kids get older, they tend to make this shift to center-based care. Parents may be thinking about a more formal preschool experience, that sort of thing. Why that matters is because this slide helps show what is happening to regulated programs across the state. Like Kelly shared, in Marathon County, there has been a steep decline. The trend is statewide. We are losing providers. The trend for family childcare is extraordinary, which means families who are really looking for those infant toddler placements are struggling beyond belief. When I did care, it was in Iowa. I had a 2+ year wait list for an infant. I had parents asking me when they might be able to think about trying for their next baby based on when I had a spot open. That is intense, right? We want every family to be able to have their family and their children cared for in supported early education settings from the get-go, right? That's our goal. Rural communities are being hit, I would say, relatively hard in this loss. There has been some growth in some parts of the state with center-based programming, but for the most part, it has been a decline, and that is something that we take very seriously. I know some wage conversation happened with Kelly's information as well. This one really just gets to me. The green is a high school graduate in the state of Wisconsin and what they typically earn, which is about $15 an hour. Early educators, $12.99-ish on average. Family providers, about $7.25. Family providers work on average 50 to 60+ hours a week. Center directors work just as many hours. The yellow shows that there are at least 20% of our providers suffer from food insecurity. So as they are trying to help care for other people's families, they are struggling to care for their own. Why this is really impactful to me on this slide is over 80% of our early educators have some college-based credit behind them. We are an extraordinarily educated sector of professionals, and yet we are making less than what high school graduates make on average, right? Because the funding model is broken for the field of education, it impacts and compresses wages to a degree that it becomes untenable to stay in this field, even if you are an excellent educator. So with this, we have been working around the state with communities like yours to think about what can we do? What's working out there? What are people trying? There was a large deflation in our field when Build Back Better did not choose to include $4 billion for early care and education. When we were told, hang on, it's coming, don't worry, it's coming, it didn't come. There were programs that were basically limping towards being able to be supported with some of those dollars to make sure they could stay open. They didn't make it. People are realizing we have to figure this out in our own communities, right? There isn't going to be somebody that comes to save us. We are the ones we've been waiting for, right? So some of these are models about other communities that we've worked with that have started figuring things out and testing and piloting things. So I know this is really small. I'm going to share the PowerPoint with everybody so that you can actually read through at your own leisure. But I'm going to sort of give you broad strokes of the conversations that are happening. This is happening in Antigo, where they are having a multi-tiered model of business investment. So they're doing sort of gold, silver, and bronze sponsorship, basically. And when companies commit to that, they then receive a benefit of placement in the child care program. There have sort of the details of what the different levels are that they buy in for. The idea is that childcare needs a different infusion of cash to actually make the business model work. Businesses and communities benefit from having excellent childcare in their communities, So therefore, thinking about how do we have everybody that benefits support this public good that is childcare. They have done a little bit of sort of restructuring and wondering about how to make the model maybe work a little bit better. So this is an ongoing conversation. It's not a one and done. They're not the silver bullet. They're part of the buckshot. They started small. They had 38 slots when they opened. Their 5-year plan is to open another full center on top of expanding the one they currently have. It's a work in progress. I heard the director speak recently, and she's like, I wish I would have done a couple things differently. So just think as you're doing your own community planning with your Dream Up work, you may start in one place. I guarantee you, I'll put $5 down, you're not going to end up there, right? It doesn't work that way when it comes to childcare. It's complex. As I said, if it was easy to solve, we would have solved it by now. So I will just encourage you to stay flexible, stay resilient, do a lot of work really mapping your assets so that you can figure out what unique things Marathon County has to offer to really build a beautiful childcare system that will work for your community. There is another program in Antigo that is working with 2 major employers. They are figuring out their own system of how to do sort of employer buy-in for slots. The conversation is typically, do they buy an actual slot that is always for that program, or do they buy priority on a wait list, or is it some combination of both? So as folks are coming up with these solutions, I beg you, please keep providers at the table. They are the ones that are going to be able to inform you if the things that you are thinking about can actually work in real life, because they're the ones that are managing those wait lists and those slots and have a sense of how that actually works in real life. Where folks on the outside may say, hey, we have this model, we think this is going to work. Always, always, always have providers at the table with you in those planning processes. They know a lot about the industry, and they can help communities from making mistakes sort of upfront to save some of that frustration of piloting something and having it fall flat. This is Door County. They are actually doing a version of Partner Up, where there is a stipend that is paid partially by an employer, and then they have a foundation that is actually matching part of that tuition cost for families. They're doing a 9-month version of this, checking out, see how it goes, and if it works, then figuring out sort of what comes next for that. Again, it just recognizes that childcare needs additional funding coming into it to actually cover the true cost of care. And then this is Jackson County. Jackson County has had their community group working for several years at this point. They came together probably about 3 years ago and said, wow, childcare is an issue. We have lost a ton of providers. We might be losing more programs because directors are leaving and there's no stability. What are we going to do? So they have organized and met regularly. They have elected officials on their network. They have providers in their network. They have other childcare experts from Childcare Resource and Referral, from WECA, to all come together to say, how are we going to do this? They have sort of incorporated it into what they call the Jackson County Childcare Network. It has become a funnel for them to be able to write grants on behalf of childcare programs, and then be the ones that sort of deliver that support to the programs themselves. If a provider has a need, instead of going to either businesses or all over the place, they know they can come to the network, create their ask. One provider needed a fence so she can move from being certified to being licensed. That's adding 5 slots potentially to that community's childcare infrastructure, right? The network was able to find funding to support that fence so she could then move into a larger capacity service for her community. They also are trying to figure out this wage thing. They are doing a deep dive into cooperative model study to see if there is anything we can learn from the cooperative model to help childcare be more expansive in its thinking about when it comes to funding models. They are in conversation with the school district to say, basically, is there a way that we can partner with you so that the wages for school employees who are doing care for young children, and the local childcare community can actually be on the same wage scale. Because what happens when some partners open up new programs, like a hospital or a school district, they can pay more than the local childcare programs can. And that creates an imbalance, and then the providers who are working at those local programs move to a better wage job, and that is no shame in that. They're taking care of themselves and their families, and that's a smart move economically. But then it hobbles the local system. So as communities are having these conversations, we are really careful to say, make sure you include the local infrastructure of childcare in whatever programming you are thinking about. Don't dump all of your resources into starting new programs when the programs you have may have needs that you can help support them with. We have heard time and time again across the state, we have 3 rooms that are closed because we can't find staff. We could be taking care of 150 kids, but right now we can only do 75 because we can't find the staff. So make sure your operating programs are well taken care of and supported while you also figure out what comes next for your community and how you expand the capacity of care you're able to give. Jackson County's goal is 500 new slots in 5 years. They are an audacious group, I'll just say that. But if you've ever met Marianne Torkelson, who is sort of heading up this network, she is a woman that gets things done. It's been very exciting to be part of this group and see what they've accomplished. So the other half of the childcare puzzle is advocacy. We know that the Child Care Counts funding has an end date put on it. We know childcare programs have said, we will not be able to operate when those funds are gone, period. We just can't. WECA is facilitating a 50-plus entity cross-sector advocacy group that is really pushing for bold change for Wisconsin's children. Our goal is that every kid, no matter where they are in the state, no matter their social economic status, has access to quality care, and those educators who are doing that care are also supported in that process. Like, it has to be a both and. So they have several groups that they're working with. There's a state collab team, there are employers in economic development, there are parents, and there are the educators themselves. And those 4 columns sort of make up some of the voices that are at that table to talk about how we get this policy moved in Wisconsin, because we can't keep doing what's been done because we all know it hasn't worked. And so unless we are actually really ready to make some change, this entity is going to just keep limping along. And childcare is going to be hobbled, and they don't deserve that. Their job is so important. The brain development that they support, the family support that they provide is beyond essential. I know we have thrown that word around a lot, but I will tell you it is beyond essential. Communities can't work without childcare. Families can't function without childcare. Brain development doesn't happen to its fullest potential if kids aren't in environments where there is a good serve and return as far as interactions, where there's people who actually want to be with those kids and know what they're doing to be with those kids. So please hear that that is a key part of any moving forward, is really holding up the profession of childcare. So this is what we need. We need a sustained funding investment in early care and education, period. If we don't get that by 2024, we will have an even more catastrophic loss. And I am not like a person that's like, oh, it's drama. No, this is based on programs communicating to us directly. They can't stay open without these funds. What Raising Wisconsin is working towards is a $300 million investment in early care and education to help keep the funding levels at similar levels to what they were for Child Care Counts money that is currently coming into programs, and to bolster up additional infrastructure for childcare. It seems like a lot. Our state is also sitting currently on about $7 billion of excess funding. We want to make sure that our legislators hear that childcare is a priority. They've heard from providers, and then the legislator said, oh, well, we haven't really heard from parents. We got them, we haven't heard from businesses. We got businesses to say, this is a problem, we can't hire because we don't have childcare. Well, we haven't heard from parents. So now we're gathering parent stories. Every single person who is impacted by this childcare situation that is happening right now should be reaching out to the legislators to tell them how it is hurting their community by not having this funding for childcare. In addition, we have asks around mental health for infants and toddlers and some home visiting, because we know research shows that when young children and young families are supported in these ways, we have better outcomes for those families and those children. This is a little bit wonky, but just for folks who want to understand sort of the legislative cycle, we are coming up to sort of budget creation and eventually the budget ask. So right now, in the next several months, will be key times for folks to be talking to their legislators about what's going on. I know Elsa has been working in communities to bring legislators who are the elected officials from these areas to these types of meetings so that they can actually hear from providers, from parents, from business owners, the impact that not having viable, vibrant childcare is having on their communities. So we will be hitting sort of hard and fierce on this ask, and we may be coming back to groups like yours to say, are you interested in joining us in putting your voice forward? So if you are, you can hop on your phone right now. I won't be mad that you're on your phone when I'm speaking, to go to Raising Wisconsin and sign up for updates. That's one of the best ways to stay kind of connected to this advocacy work. We also have individualized toolkits. So if you go to the Raising Wisconsin website, if you are an employer, guess what? We have a toolkit for you to be able to use with speaking with your elected officials. If you are a professional early childcare provider, we have a toolkit for you to be able to use. If you are a community leader or a parent, because we all know that we come at this work with a different angle and a different need, but we all need childcare. So our job at Raising Wisconsin is to really bring together anybody that's affected by not having childcare in their community or having a childcare program that is not as fully supported as it could be or should be. And to me, that's probably just about everybody in a community, honestly. So we welcome you to come join us at Raising Wisconsin, to put your name in, to stay up to date on sort of the advocacy asks, and we may come back to your community to ask for stories so that we can share those stories in meaningful ways with the folks that we are having our conversations with, so they understand the impact that this childcare reality is having. So Jackie, whose information is up there, she is the director of Raising Wisconsin. And then my contact up there for WECA, the Wisconsin Early Education Shared Services Network. Reach out to us, we'll be happy to talk. I have cards later. We want to support your community in having these really important conversations. So thank you for that.
Thank you, Kelly. It looks like Elsa's on her way up here to talk a little bit more. Elsa, welcome. She's going to talk a little bit more about the work that she's doing with her Worker Advancement Initiative grant. So, sorry I don't have a joke to share or anything until she gets here, but.
Here's Elsa.
Hi, everyone. My name is Elsa Duranzo. I am the WAI grant coordinator for the North Central Wisconsin Workforce Development Board. This is us. We are a pretty small group of people. We are really awesome at what we do. And what do? There we go. We connect. So our mission is to cultivate a skilled and competitive workforce which meets the demands of the employers in the region. And we cover a 9-county region, which is Vilas, Oneida, Forest, Lincoln, Langlade, Marathon, Portage, Wood, and Adams County. We oversee all the job centers throughout that area. We also plan, administer, and coordinate employment training programs in collaboration with colleges and other education institutions. And overall, we identify solutions to local workforce needs in collaboration with local elected officials, economic development corporations, businesses, and the community. Get rid of it, okay. All right, so the Worker Advancement Initiative Grant. WAI is a workforce development project that's made available by the American Rescue Plan Act, Coronavirus State and Local Fiscal Recovery Funds. During the application process, NCWWDB identified 6 of the most estimated industries in our region, which happen to be the healthcare, transportation, which would be like CDL, heavy equipment operator, road construction, and then manufacturing, construction, tourism, and childcare. Historically, we've supported training in and have solid partnerships in healthcare, manufacturing, construction, transportation, and tourism. However, childcare, not so much. But we believe that childcare is quality childcare is the foundation to a healthy workforce and ultimately to a healthy community. So we developed the WAI Childcare Project. Through this grant opportunity, eligible applicants will receive individualized services to work toward becoming a certified and/or licensed home childcare provider. Examples of services that WAI can provide may include background checks and fingerprinting, county and state application fees, required training and courses, well testing for providers that happen to have private wells, home safety upgrades and fencing, and other necessary support services to reduce the barriers to complete the steps towards regulation. So where did we start? In order to understand our goal, we needed to get a better grasp on what the issue actually is. So we reached out to our child care resource and referral agencies in our service area, which include Northwest Connection Family Resources and Childcaring. We also reached out to the Bureau of Early Care Regulation for insight. After many calls and many more emails, it became apparent that this industry is incredibly complex and there are seemingly infinite variables to consider. But through it all, we identified 2 categories of issues. Why are people quitting and why aren't people starting? So why are people quitting? We've heard that there are long hours, low pay, and the cost to provide care is increasing. And then there was COVID, and we all know what COVID did. So why aren't people starting? Again, the low wages, long work hours, cost of care, but also people can offer childcare without being regulated. The regulation process is confusing, and the startup costs can be pretty steep. But we know that someone is caring for these kids, somebody's family, the friends, or neighbors. We've also seen a rise in parents choosing to stay home. So the issues with that are when family, friends, or neighbors are caring for your kids, it's not regulated. Unregulated providers don't have to adhere to state safety standards. They don't have to provide any educational structure during their care. Also, unregulated providers, they can't accept state subsidy programs like the Wisconsin Shares, which helps the parents with the cost of care. It can also be assumed that unregulated caregivers are not making comparable wages as regulated ones because they can't take advantage of state programs like child care counts or the food program. Further issues with the parents staying home is that their household income decreases, and then also their leaving the workforce is making the labor shortage worse. So our next question is, how do you get unregulated providers and newly stay-at-home parents to become regulated? Well, how do you become regulated? You jump through a ton of hoops. The process is confusing and it's different for everyone. There's no one-stop shop to get everything done. The DCF website is a nightmare, and I will say that again. The DCF website is a nightmare. And then it takes dedication to remain engaged through the process. So we designed a training and funding flow that keeps participants engaged and motivated to finish the steps as quickly as they can within their ability. We built into the training 3 incentive benchmarks: $100 after signing a Youngstar contract, which can happen when they become provisionally certified, then $300 for becoming certified, and another $300 for when they become licensed. We also have written into this an incentive for providers who offer off-hours care, but that amount is to be determined because we have yet to have anyone fall into that category. So the first step in our process is to assess the participants' basic needs. This is where we determine what the total allowable funding could be, and we ask things like, can they sustain their everyday expenses while they're in this training? Do they have basic computer skills? Do they have a computer? Do they have internet, printer? Right. So then the second part is like, how do we find our target audience? We use the DCF unregulated providers list, which are non-certified licensed caregivers who received warnings by the county or state for being in violation of home child care guidelines or laws. I sent out notices offering guidance and letting them know that we can provide financial support to bring them to code. I had 0 responses from that. We've joined, monitored, and posted on Craigslist, Instagram, and Facebook parent groups, child care groups, and community pages. Facebook has been hugely successful. We are engaging our 9 county community leaders, tribal members, rural church communities, and schools with these info sessions and roundtable discussions, which are open to the public. We've hosted community conversations for the Lac de Flambeau Tribe, Lincoln County, and now here tonight, Marathon County. So thank you to WECA, Childcaring, and all of our other collaborators for supporting these conversations. This is our current progress. So far, I started in January and took about 2 months to learn this industry before we started actually reaching out to the public in our plan. So since March, we have 21 participants. 19 of them are becoming new family home. 2 of them are considered employee or substitutes. So I do know that one is a wife and husband duo, and the other is a mother-daughter duo. We have 4 people who have gotten to the certification regulation, and we just had our very first participant who went all the way just last week and is now fully licensed, and she is located in Wood County. We have the approximate cost per participant is about $3,000, and that does not include the cost of a fence. The fences and the costs are variable. We had one person who was able to install a fence for less than $1,000, and then we had one right here in Wausau that was over $4,000 because of the type of material that was allowable by the city standards. So in total, 5 fences have been funded at $10,500. All right. So the pandemic, as difficult as it has been, has brought us new opportunities, and we haven't had this type of flexibility under our typical workforce development programs in the past, and we're taking this opportunity to make the greatest positive impact that we can in our communities. We ask that you participate in our child care project and Dream Up strategic planning by completing these surveys, and all that apply to you. I'll also email these links to everyone attending virtually, as well to everyone who leaves their contact info here tonight. I can go down there.
Okay. Well, I think it's time. We're scheduled to end at about 6:30, and we would like to open it up to questions. So Elsa has the microphone, and so if folks have questions for those of us here this evening, we'd welcome your questions or comments, right? Yeah. Do you want to raise your hand if anyone has a question? And how will we monitor the chat?
Chris, can you monitor the chat? Thank you. Does anybody have any questions here in the audience?
We have a shy group of people.
You want to. It's okay. For providers, are there anything you want to share with your community so they know what's real and your reality?
Yeah, are there any providers in the audience tonight?
There are.
There are? Yeah.
Yeah, they are.
Did you want
Perfect.
I was a little late, so I missed a little bit of it. I was thinking when you're out there, if you're tired and you know it, give a yawn. So I am a childcare provider. I've kind of taken a break a little bit, but I just want to talk about getting quality care, for our parents, and also helping them with the cost. I think one great thing with a lower cost for them, they wouldn't have to use it as much. A lot of times, their kid, we bring our kids all the time because we pay for that, and so we want to use that. So when we're able to offer them different ways to reduce that cost, that's keeping the families together more because they're able to stay home or do different things like that in there. So I think that's one big thing as a child care provider that I saw, that parents need a break a lot of times. So we're doing great, with all the grants, and people are able to bring up the wages. When we brought that up on there, I was surprised that wages is still up there. But the more that we can continue with the wages and continue to grow together, I think we can do some good things. So.
would you be able to tell us a little bit about your program that you have? Are you a family home? How many children do you want?
I'm interested in doing a family home. Right now I'm doing an unregulated family home, so because I have less than the 3 children in there. So I've been in childcare. My name's Jennifer Whips Westcott, and I've been in childcare since about 2010 here in Wausau. I've worked at a lot of different childcares. I did unregulated, parochial backgrounds, different things like that, and it just got to the point where I can't. I need more for our children. I need our children to have a really good place to be, and so I had to take a step back. I got my director credentials. I'm ready to do more things like that, but we got to bring the joy back, and we got to bring what children really need from it in there. So that's why I'm here tonight.
Okay. We sincerely appreciate I don't know that, I think everybody can hear me except for them. Okay. How is it? Okay. Jennifer, we sincerely appreciate your thoughts and opinions on that, and you're absolutely right. I think that this conversation tonight and the work with our Dream Up committee is working to solve some of those issues, and we need you in this field. So I hope that you find your way back and are here to continue the conversations. Other thoughts or perspectives from folks in the audience? Yes.
Are there any employers that are here or online who can speak to any of the experiences that they've been having, with perhaps not being able to bring in the candidates that they would like because there is a lack of childcare or anything that is similar to that?
So we're here with the Y, and we have applicants applying, but it's not always people who have any background in childcare. So that's where a lot of our DCF funding is going, is making sure they get the books they need or the classes they need, because you're getting people who haven't been in childcare. I think what our downtown branch is doing really well is we've partnered with the school district, for Wausau School District, and getting those classes that do the EC1, EC2 in the school, in high school, and they are coming into our centers and seeing what early childhood is like and kind of getting that taste early. So I think that partnership has been really good. And we haven't ever had to close a room because we haven't had the staff, so that's always been good. But it's just getting high quality teachers in and training them, but in making the profession something that everybody wants to do, right? And making businesses look at it as a true profession, not just a babysitting job.
Thank you.
Yeah, I'll just add that whole notion of sort of public respect for early care and education. I don't let people say the B word around me. Babysitting? No. Unless I'm 12 years old and eating pizza out of your freezer after the kids go to bed on a Friday night, These folks are early educators. Like I showed with our stats, they are highly educated relative to the working sectors in Wisconsin. With your Dream Up possibilities, you really have a chance to craft something for your community that fits your community, that builds on the strengths of your communities. And I encourage people as they are thinking about what's possible, really keep in mind, what do families deserve? What do children deserve? What do early educators deserve? What does your community deserve? It is going to take some passion and creativity. It is going to take people really listening deeply to each other. It is going to need to have lots of people from different parts of your community coming together and being committed to this. But in watching these other childcare task forces around the state that existed even before Dream Up, they can do some pretty amazing things because your community has strengths that no other community has. So really think about, learn from these other models, see what they're doing, but don't think that there's any sort of cookie cutter way for Marathon County. You have brilliant people here that know deeply what your community needs. You have providers that are here ready to take care of your children in your community. You have businesses and philanthropy that can help build a new model for a vibrant childcare infrastructure for Marathon. And that is really exciting. So please take that mantle and run with it.
Awesome. I love that. That's very inspiring. Thank you. Other questions, comments? We do. Oh, Chris. I think Chris wants you to go back and.
We have someone online.
And we can't see them, so.
We have 2 questions here. So from Linda Firmholtz, what can the university and technical colleges do to help with the shortage of daycare teachers? The School of Education would like to help solve this issue. What is necessary to increase the pool of applicants?
I think that's key. Obviously, that is very key, and I think that we have to start from when children are young to start talking about this field and inspiring them to come into early childhood, right? Like I think we've talked about different pipeline types of programs where we're infusing educational opportunities even for middle schoolers to start thinking about childcare and early childhood as a viable, education and career choice. We do have actually in Marathon County both the technical college and the university here as part of the Dream Up conversations, and there is a lot of efforts in working on this sort of pipeline project. And
We need an infrastructure.
yes.
When they come out of their education experience, they're coming into a profession that compensates them commensurate with their education and expertise.
Correct. So, right, like we can work on that piece, and then it's also part of joining the advocacy efforts and community conversations like this, because it isn't going to change if we don't pay people more, right? We've seen that in all the statistics and data.
We do have that NPC career day coming up October 28th, Friday, from 9 to 1:30 at the Technical College, that you can come explore the early childhood profession. We'll be there as providers giving.
Yep. We'll be there too. October 28th.
October 28th, 9 to 1:30 at the Technical College, where we'll be there. Different entities will be there, just so you can come and talk to providers, talk to teachers, talk to the directors, figure out maybe this profession you want to go in. So maybe we could send more information to everybody about that career exploration day so that people can come and see what it's all about.
Check us out. Yeah. Great idea. Thank you, Stephanie. Mm-hmm.
That was the last question online. So.
Yeah. Take over, please.
So I know that there are providers in the room. I'm guessing there are parents. Yes, maybe? Raise your hand. All right, we have a couple parents here. Do we maybe have business or elected officials? All right, so we have some folks that haven't raised their hand yet, and I want to know why you're here. If you're not a provider, you're not a parent, you're not an employer, you're not an elected official, something brought you here tonight and you care about this issue and you want to know more, and I would love to hear what brought you here and what you might be looking for that we can help provide.
All right, spill.
Be brave, you can do it.
I know that a lot of us that are here are on the Dream Out cohort, so we may not fall under any of those.
But you said yes to being on the cohort. Why? Like, what's drawing you to this issue? There's so much a community can work on. Why this now for you?
I'm Chair Wausau, Director of Community Impact for United Way, and part of the Dream Up cohort to provide staff support for our Leaders Coalition. And I'm here because it's so important. For United Way, our whole goal going forward is to lift 10,000 community members to community disability by 2033. It's a huge goal, and child care is going to play a huge part of that, not only for the providers, but for parents and for the teachers as well. So for us, it's a very important conversation in the past, now, and in the future.
We're part of the Workforce Development Board, and Elsa said it the best, that quality child care is so important to workforce in our community and that connection between job seekers and employers.
Thank you for being here. They might need it though for Zoom.
Okay, I will. Okay. To be an infant teacher almost requires a master's level education. Caring for an infant and knowing how their development is and how to be able to observe their movements and not place these things on them is so valuable. So I'm so happy to be here to help advocate for our teachers so that our community can say, this is valuable work, this is very difficult, and having a well-educated person there to take care of them is going to make everybody's life 100% better. So I think keep moving for that.
And I'm Tim Parker with the Community Foundation of North Central Wisconsin. I'm here to learn more about the issue. We know it's an issue for our community and the other, the rest of our area that we serve outside of Marathon County. So just trying to understand that to see what our role might be in helping solve the issue and find solutions.
Are you moving to another person, Elsa, or?
I think there's a question online.
Okay.
Okay, we have a comment from Allison. Higher wages help with education costs, benefits, and paid time off. Public health employee, we're working on it in our community. It's a problem everywhere.
Excellent. Very accurate, on task. Exactly all the things that we've been saying this evening. Mm-hmm. Other comments from the folks up here?
Shout out to my public health sister.
That's right.
Thank you for commenting. It is, the truth of it is it's a public health concern. And so we need to approach it from that perspective. I think that a lot of us in public health have been really focused on COVID and COVID-related activities for the past couple of years. It's really put a spotlight on a lot of the things that we need to address now. COVID really put a lot of strain on the existing child care entities within our county, and we need to work as a group. No one organization is going to solve this. And so it's really, I love hearing about other places and how they're starting to think creatively. And I think that there's just a world of opportunity here. And I know for one, when I get into the meetings, everybody's really excited and active about what could be, and all of us have this piece of this puzzle. I foresee that there's going to be some really cool actions that come from this. That's my 2 cents.
Allison added that the need to contact potential employees young. We have to show them it is a desirable field and actually make it a desirable field.
Good point, yes.
I was thinking about what our public health partner here talked about with the impact of COVID. It was economic disruption for childcare. It was fear for their lives when it first happened because they had no idea. Like, we didn't know as a community how to handle it and what the repercussions were going to be. For family providers, it was an extra stress because it's in their home and they had nowhere to then sort of shelter or isolate if need be, right? And they were having folks coming in. That was all incredibly scary. We at WECA, and I know the CCNRs, also partnered with public health extensively across the Wisconsin to help get information out, to help get accurate information about vaccines and other options to help provide healthy care for the kids. What we know is that during COVID, about 40% of childcare programs at some point closed across the United States, 17% in Wisconsin. We are hardworking people. With the supports that our organization was able to provide for the programs within WECA, it was less than 0.3%. So 17% in general, less than 0.3% for our programs, which tells us that when childcare providers are supported, they can make it. They know how to run their businesses. They know how to be with children and support families. What they need assistance with is getting through the systems and figuring out those extra funding pieces to make it work. So as you are considering your plans, just remember that you have experts in your midst who understand this field deeply, and you're going to need to talk to them. Because as Elsa said, as we know, licensing can feel like a labyrinth. And unless you are highly dedicated and know how to manage systems, you may get discouraged. Part of our job, part of CCNR's job, is to help remove systematic barriers for folks coming into the field and who are in the field so that they stay in the field. So as these providers are coming in, we want them well supported from day one so that they can have a successful business, they can give back to their community, they can provide this needed service, and oh yeah, maybe when they're done doing this work in 30, 40 years, they can actually retire and have something there for them after doing this hard work. Family providers don't get benefits typically unless they can get them through their partner. They don't typically plan for retirement. Usually what happens is everything they have gets invested back in that business. When I was working with family childcare providers, we did a mathematical experiment. How many hours do you work? What's your take home? Some of these providers were working for less than $4 an hour. 60 hours a week, right? They want to serve, but they deserve to be supported so that they can make a living doing this work.
Good.
Thank you, Kelly. Elsa, how are we doing back there? Okay. Okay, if anyone else would like to comment, I'll call last call for comments. Do you have another comment? Oh, you're just kicking back. Okay. Well, we will take this opportunity then to say thank you to each and every one of you for being here this evening. If you want to continue this conversation, we encourage and invite you to reach out to us. We ask that you also, Elsa will be sending you some information about those surveys. That will be extremely helpful for us in moving forward with some of our Dream Up planning. And yeah, thank you. And we hope to hear from you, and safe travels back. Thank you. It's gonna be great. Yeah.
Do you have
I just want to add that those surveys do have a place for you to put which county you currently reside in, or as an employer you are located in. So we would be happy to distribute the results of the surveys to the task forces that are in your area. So please share that survey with everyone you know. Thank you.